maximizing this interdisciplinary approach. The benefits of ethical behavior go beyond patient care, but directly affects the economics of staffing and effort management. It can be argued that ethics began in the 5th century with the Hippocratic Oath. By choosing to engage in practices that benefit and do not harm people, these early physicians sought to behave with social responsibility or ethics. The AMA first adopted a medical code of ethics in 1847. In the 1970s marked the beginning of ethics education in medical schools, and in 1997 the first ethics conference was held in medicine. So why did it take centuries to return to the original promise Hippocrates made to be honest and loyal while advancing helpful practices? Ethical dilemmas relating to access and affordability of health care are currently at the heart of American politics. As of 2009, healthcare costs are estimated to be 17.3% of our GDP and are threatening to rise above 20%, or 1/5 of our economy. This makes medicine a pivotal piece of our national economic puzzle. Recent ethics violations have cost businesses trillions of dollars in loss of market share, profit, and public confidence. Ethical conflict is a daily occurrence in healthcare. From end-of-life care, abortion, resource allocation, that's just a few examples of daily debates. But does ethical decision-making in and of itself impact healthcare's bottom line or the cost of healthcare in general? There is emerging evidence that by implementing ethical models for healthcare management, that will be beneficial and more cost-effective for institutions. Ethics, from the Greek word ethos, makes the pursuit of what is right a cultural ideal that is integral in the character development of individuals and societies. Expanding this idea to include healthcare institutions explains why it is an important pursuit. Making ethical behavior the responsibility of the individual as well as the organizational structure fulfills the promises made to the patient as well as the mission of the institution. And this explains why I took on this study. JCHO, or the Joint Commission of Accreditation of Healthcare Organization, is an independent, not-for-profit organization that since 1951 certifies over 19,000 healthcare organizations and programs in the United States. They are the oldest and most well-known accrediting body. Hospitals adhere to federal and state regulations that are recognized all or in part through this accreditation process. They often publish sentinel events such as this one designed to promote quality and safe practices. This sentinel event recognizes that to assure quality and promote a culture of safety, recognizing that patients' care hinges on cooperative environments, and through this cooperative environment, costs are reduced. The impact of ethical behavior directly affects the entire organization. The ethics of coworkers and managers has the greatest effect on the individual employee. The emotional intelligence of the staff is the primary indicator for the expected ethical behavior. The greater the emotional intelligence, the more ethical the behavior. A review of related nursing literature revealed that the degree of moral distress a nurse faces in ethical dilemmas is a major contributor to job satisfaction. Job satisfaction directly affects care delivered, level of productivity, development of personal health problems, increased burnout, and increased staff turnover. CMS, or the Center for Medicaid and Medicare Services, as of October 1st of this year, are tying 1 to 4% of reimbursements to patient satisfaction surveys. They have also implemented other pay-for-performance programs that are outcome-based, such as SCIP measures, which are surgical care improvement projects. And the question of why is because better patient outcomes have fewer errors. Better patient outcomes occur when employees are happy and engaged. And overall, this creates for better institutional performance. There's a nonprofit consulting firm called Plaintree, and they're trying to shift their management, their organizational structure away from market-driven approaches towards a more patient-centered model. And they feel that by incorporating these higher operational expenses in investing in their institution, they will benefit more cost savings in the long run, a longer financial improvement by having better outcomes, higher staff retention, a more satisfied patient and staff group, and having fewer errors, most importantly. Ethical institutions start from the top down with a shared mission and vision statement, and then that makes it pervasive throughout the organization. The American College of Healthcare Executives 2011-2013 strategic plan embraces the core value of integrity. We advocate and emulate high ethical conduct in all we do. ethical code among the ACHE members is higher now than it was last surveyed in 2003. The greatest reported dilemma in healthcare occurs when addressing medical errors. What do you do? What does the institution do? The goal is to promote a less punitive, values-based environment that advocates full disclosure as required by JCHO. Often, a deny and defend posture is taken in an attempt to avoid lawsuits or other negative repercussions. Full disclosure and apologize is consistent with ethical principles of trust and patient autonomy. This implied contract made by healthcare professionals to the patient is to provide the best possible care. The way an organization approaches medical errors often defines their culture. Ethical institutions will build foundations for the future by educating staff, attempting to eradicate that type of behavior in the future, and addressing and remediating a plan that will improve care and make the staff the highest quality with the best resources and tools. The results of this non-punitive approach shows commitment by the organization, improved outcomes, lower staff turnover, more productivity, and better long-term financial performance. This concept of shared responsibility, stewardship, protecting interests of patients, stakeholders, and employees becomes center stage. This is my niece's graduation, by the way. The key to our future are to educate. You see her? The key to our future are to educate ethical commitments. 2 studies provide a glimpse of the importance of formal ethical education. Undergraduate healthcare administration students, this is Laura and Marilyn's study, showed values to be high to moderately high, whereas a startling finding resulted when medical students regressed in moral reasoning from their first to their 3rd year. Ethical clinicians are essential to providing quality patient care. A quote from Deshpande sums this up nicely. Healthcare is one sector where consumers are not only more vulnerable, but less knowledgeable about products and services. Patients rely on our judgment, expertise, and integrity. Many models today promote patient-centered involvement for cost control. This is based on the premise that unnecessary services and studies are preventable with an informed consumer. However, with 23% of American adults being functionally illiterate, relying on these patients to make informed decisions is unrealistic and irresponsible. Carefully guided discussions that weigh risks and benefits are essential. Research also points toward the need for healthcare to be able to make quick decisions. For this reason, models are being developed for ethical reasoning education in medical schools and ethical frameworks for clinicians to use in dealing with conflict. The concepts and frameworks are vital in representing best practices and best decision-making for all. In the study we just heard by Hamel, Butler, and Macia, it is noted that as values increase, moral reasoning declines. This is supported yet again in another study finding nurses to be more ethical than physicians and hospital administrators. In medicine, as education and specialization increases, so does the impact of a decision. The core ethical principles of autonomy, beneficence, non-maleficence, justice, and trustworthiness provide the framework for ethical decision-making. Most medical literature concerning ethics pertains to constrained resources in public health systems. Aside from greatest need, evidence-based medicine is an approach to enhance outcomes with the least amount of errors. Evidence-based medicine is a systematic approach to deliver the highest quality, most appropriate care with properly allocated resources to patients in need. The best practices are not only most cost-effective, but also a moral obligation. Ethical decision-making in medical context must not be evidence-based, but also value-based. But how do we find a return on investment in healthcare? The question is one I struggle with on a daily basis. Equating quality care or available prompt care with equitable distribution of services is not without cost or controversy. Odo's 2001 study attempts to define return on investment by substituting the word quality for return or benefit. When dealing with a human life, thus avoiding the attachment of a dollar value to an individual. If evidence-based medicine is the gold standard for medical decisions, then why not use the same theory to justify healthcare management decisions? Paul Hoffman advocates using evidence-based management techniques when trying to arrive at ethically based decisions. Cultivating best management practices is the ethical challenge for leaders trying to make financial decisions that are moral and just. Common sense tells us that ethical decisions are the right thing to do. But as pressure mounts to improve efficiency, the cost of federal regulation has risen, high pharmaceutical costs and shortages are prevalent, liability costs have increased, and so have all the other operational expenses in hospitals.